Hey guys, it's Tony Paladin, and today we're going to be discussing cervicalgia and thoracic back pain. Big word, what does that mean? Cervicalgia. Cervicalgia is a fancy medical term for neck pain, and thoracic back pain, also big word, means upper back pain. So we're going to be looking at neck pain and back pain. What are the causes, how to fix it, and just a couple of key home tips in order to alleviate basic unspecified pain of no real origin. So for starters, before we continue, the true definitions of cervicalgia and thoracic back pain, which fall into a category called dorsalgia, another big word for unspecified back pain, which the lower back pain term would be lumbago, another big term that no one really knows what it means, is a pain of an unknown origin. So it's pain really due to muscle tightness. There's no obvious disc herniation. There's no obvious facet joint injury. There's no obvious muscle strain. It's really pain just due to muscle tightness, and it can be pretty irritating when you're doing basic things like trying to text, wash the dishes, sleep, sit at a desk, operate a mouse. And we're going to do a couple of things that you can do at home and also at the office where you can effectively alleviate this pain. So before we continue, let's just look a little bit about the anatomy and the structure versus the function as to what's going on in the thoracic spine and the cervical spine, i.e. the upper back and the neck, and then just see what sort of position should we be looking for prior to exercise so that we don't make the condition worse before we're making it better. So if we turn to the side, specifically looking at the thoracic spine, the upper back segment, and the cervical spine being the neck segment. Ideally, what you want to have is as much extension as possible. So what you don't want to have is you don't want to have your neck extensors overactive so that your chin tucks forward, so that these muscles are shortened. And what you also don't want to have is something called a functional kyphosis, where your upper back tends to round and pull you into a rounded position. So what you don't want to have is a very S-shaped looking posture. Ideally, what you want to do is have something that aligns to a plumb line, so basically a straight line where you are fully extended. Now, a quick tip to get this right is if you take your fingers and you put them on the top of your head and you pull yourself upwards, you're going to be as tall as possible. So if I grab Simon's crown and pull him upwards, he's not going to like the feeling of the hair being pulled out of his head, and he's going to extend upwards as much as he can. So therefore lengthening the neck or the cervical muscles and lengthening the thoracic muscles. So once you've effectively got into the position of neutral posture, which is full extension, plumb line, having someone yank on the crown of your head, we're going to run through a couple of really basic exercises in order to alleviate the discomfort that you feel from the bunched up muscles in the cervical extensors and the thoracic extensors. So the first exercise we're going to do, very, very simple. If we turn and face forward, once you've got your posture set, that someone's pulling you up on the crown, we're going to do a very basic exercise where you allow your ear to drop down towards your shoulder, but throughout the movement, trying to maintain as much spinal flexion as possible. So you don't want to have too much movement happening at one particular junction. You want to try and have the spine extended, and just picture that the spine is extending throughout all of its structures. Specifically because it's a neck exercise, the shoulders need to stay quite level, and the movement basically takes place from the big vertebra or the big bump you can feel in between your shoulder blades upwards. So you're just getting a very, very smooth movement, trying to get as much movement as you can, and trying to get your ear as close as you can to your shoulder without causing any discomfort. Ideally, you want to work into a discomfort level of maximum sort of 6 out of 10. You don't want to be pushing this into pain. Okay, so once you've done your lateral flexion movement, the next movement we're going to do is spinal rotation. Okay, quite important that you get this right in that you want to feel that the head is rotating on its axis. So what this effectively means is that if I've pulled you up into a plumb line and I'm pulling up on the crown, that the whole head and all of its associated vertebrae are turning together. What you don't want to feel, if you do it incorrectly, is that you bunch into the neck and then you feel like I'm pushing down on your forehead and you're turning the head under duress. So ideally what you want to feel is that the head's extended. We're as tall as much as possible, and the head is just turning on a very, very basic axis. Okay, the next exercise we're going to do, if we look from the side, it's really important that you are mindful of postural correction when you do this, otherwise it could make things worse. Again, you want to get the feeling of spinal extension. You're being pulled up from the crown of the head. The shoulders are going to remain stable, and we're basically going to drop the head forward, and then we're going to extend the head up. Now, it's again quite important that you feel that the head is lengthening up as much as possible. If you're doing it incorrectly, you're allowing the head to drop forward, putting pressure on the upper back, and if you extend the head up, you're crunching and you're working too much into the spinal extensors, which again is going to cause pain at the junction of the neck. So what you really want to feel is that the head is growing as tall as you can, and when you lean forward, again, you're stretching into the spinal flexors, and then when you lean back, you're working into the spinal extensors, but the length of the head is going up towards the sky. Just a very basic postural correction to make sure that you're doing everything in a neutral posture is that alongside with pulling along the crown of the head is that you want to try and feel that you've got a tennis ball underneath the chin. So you want to have the feeling that you are drawing up as much as you can and that you are activating your spinal flexors or the muscles in the front in order to support the spinal extensors. So it's just another checkpoint to make sure that the spine is in a neutral position before you start to do exercises on it. If we take the exercises down to the floor, there's a few basics on the floor that we do. These are a little bit more advanced, so you just want to take care with these that you don't hurt yourself. So the first one we're going to do is lying on our back. It's called a floor angel. Ideally, what you want to do is take a towel, roll it up. It should be about 10 to 15 centimeters thick, and you want to place it between your shoulder blades. Okay. You want to again lie back, make sure the head is in a neutral position. It can drop to the floor slightly, but you want to just make sure that your spine is extended as possible. So again, feel like you're being pulled by the crown of your head. And then if you keep your arms in an externally rotated position, you're going to make sure that your stomach is nice and tight, and then you're going to be extending your fingers up towards the wall or the area that's behind your head. What you want to feel in this exercise is that you are really, really stretching up as much as you can, and you're just opening up into the chest, number one, and that you're activating the muscles in between your shoulder blades, number two. If you do this exercise, it should not cause any pain. It should just cause a feeling of general relief and activation into the upper back and the neck so that you feel that your pain levels are slowly coming down. Another good tip to do with this is to keep breathing and stay quite relaxed throughout the exercise. Right, our next exercise, we're going to move onto our stomach. We'll call this a Superman. So you can put the towel under your head, and you're going to extend the hands out above you. Now, when you execute this exercise, you want to make sure that your core is strong. So try and feel like you are resisting a punch, and try and feel like you are squeezing a pencil between your butt cheeks. I know it's quite graphic, but it's just a good way of making sure that we're locking in here and not working into here. So when we execute, we're going to think about lifting our knees and our elbows off the floor. So as we come up, we make sure that the stomach is tight, the butt is tight, and what that's going to do is make sure that the muscles in between the shoulder blades are tight. If you also look at the head position, we make sure that we are not craning the head up towards the sky and working into the neck. We're keeping the head down as a continuation of the spine. We keep working into the neck flexors, or the muscles in front of the neck, in order to support the neck extensors, which are the muscles on the back of the neck. And then we go down, and then you can do a continuous repetition of this movement. If you feel any pain in the lower back or the neck, stop the movement, reset the movement, and then continue on once you've corrected your position. The next exercise we're going to do are external rotations. So you're going to keep the hands at about 90 degrees to the body. And what you're going to do again, keeping the butt active, the stomach active, pulling the shoulder blades down, you're going to just gently externally rotate the hands up towards the roof. What you want to envision is that you've got an axis sitting here, so that your movement of rotation is all through there and not pulling upwards into the neck. So we want to try and keep the shoulders down and extended, and that the axis of rotation is through the elbows, so that you're activating into the muscles in between the shoulder blades. Last exercise we're going to do are T lifts. That's when the arms are out in a T position. You're externally rotating the thumbs up towards the roof. Again, squeezing into the bum and the stomach, and then lifting the thumbs up towards the roof, activating into the muscles in between the shoulder blades. Again, with this exercise, try and make sure that you're not working into the neck and into the upper back, but that the bum and the stomach are tight and that you're feeling the activation in between the shoulder blades. If you're feeling comfortable with the first couple of exercises and we want to take it up a step further, then I caution you with the following exercises. Please make sure that we don't have any disc herniations, with no major muscle strains, anything going on in the neck where this could make things worse. If you're confident that we can move on, then we'll proceed. So the first one is what I call a prone triangle. It's basically when you're on your stomach and you're going to base out on your head and effectively load the spine. So very importantly, making sure that you maintain your spinal neutral position. So again, feel like you're being pulled up from the crown of your head, so that the head is an extension of the body. Your start position is with your hands on either side of you, on your knees, with the crown of your head positioned on the floor. You want to curl your toes under slightly, make sure that your stomach is nice and active, make sure that you're bracing into the neck flexors, which are the muscles in front, not on the back, that the neck is nice and extended. And then what we're going to do is slowly lift the knees off the floor and scoot the bum up into the air. Now, from a beginner stance, you want to try and have the weight in your hands as much as possible so that you're supporting the neck. If you're feeling confident with this, you are welcome to remove your hands and base out completely on your head. If you'd like to take this a step further into a more advanced level, what you then can do is making sure you're retaining all of the postural positions, is to then rock forward and back slowly on the head, just to get a nice activation into the into the cervical flexors, or the muscles in the front of the neck, but at no stage allowing the head to tilt back too much that you're working into the rear part of the neck or the spinal extensors. Okay, the next exercise we're going to do is on the back. Again, quite advanced, to just make sure that there's nothing major going on. The start position is with your knees bent, your elbows at the sides based out on the floor, and again with the head set in the correct position. You can base the elbows next to the body, and what we're going to do is we're going to lift the hips up into the air, and then once we've got that position, we lift the shoulders up and we base into the elbows and the head. If you feel comfortable with this position, you can then remove the elbows and make sure that you're retaining a nice neutral position. And if you're feeling very advanced, you can gently move back and forth on the head. I wouldn't do more than a few repetitions of this until you're used to the exercise, to make sure that you're not working too much into the muscles behind the head. Just make sure with these exercises, you're doing them slowly with good control, good postural activation, and at all times don't allow the head to fall back, so that you're working into the muscles behind the head that are ultimately going to cause you potential pain. Cool, guys. Thanks for listening. We're going to pick up our next video on getting into the more specifics in terms of setting into the glutes and the abdominals in order to maintain spinal extension, so that we are executing a neutral posture throughout all movement. So not just the basics in terms of freeing up the neck and the back, but basically getting into more functional movements that allow the neck and back to stay in a neutral position when you're doing a more complicated exercise.